RDW. A suboptimal elevated reading in RDW is associated with micronutrient status in the body. Here's how that works. RDW, red blood cell distribution width. So you can imagine if we did your blood draw and we put your smallest red blood cell on this side and your largest red blood cell on this side, RDW is the difference in size between those two, your red blood cell distribution width. This is very important to care about because your ability to create red blood cells is dependent upon your micronutrient status in the body. Red blood cell formation happens through a process called erythropoiesis. It begins in the bone marrow and goes through many metabolic processes until you create a mature red blood cell that's functioning in a healthy and optimal way in your bloodstream. Each one of these little metabolic steps requires different vitamins and different minerals in order for that process to happen optimally so that you get the best red blood cell possible. If you have a varying state of micronutrient status in the body due to inefficiencies or inconsistencies in your diet and supplementation, then some of your red blood cells might be bigger and some of them might be smaller. If your red blood cell distribution width, therefore, increases in that there is a large difference between the two, it means you're making inconsistent, non-uniform red blood cells, which is reflective of micronutrient status. This is especially true because we know red blood cells have a 120-day turnover rate. So you can imagine 4 months from now, you'll actually have brand new red blood cells. So when we collect your blood, we have this cool 4-month window looking at your blood that reflects what your micronutrient status was in terms of consistency over the past 4 months. If it was excellent and it was consistent, your body got everything it needed, your RDW should actually be below 13. But when it starts creeping above 13, this is when we know there were inconsistencies that created suboptimal red blood cells, which means now red blood cells, they're responsible for delivering oxygen around the body, which is going to enhance performance in any sport or cognitive venture that you're after. Beyond this, when you have elevations in RDW above 13, it's associated with both acute inflammation and chronic inflammation, which kind of makes sense, because if somebody had inconsistencies in their dietary quality, then they are going to be associated with inflammation in the body. And if you start getting inflammatory markers, well, inflammation increases pain sensitivity in your joints. So if you have sore shoulders, sore elbows, sore knees, sore hips, sore any kind of thing that's impacting your overall movement quality in everyday life or in training or in your sport, well, lots of times this isn't due to training or your own inability to have mobility in that area. No, it has everything to do with micronutrient status in the body being able to neutralize the inflammation, which unlocks your ability to move better and therefore perform better in life. RDW is wildly valuable because it reflects micronutrient status and inflammation. Those two things impact performance in literally hundreds of ways. Optimize this marker and you're going to be able to optimize anything you want to do here at Vitality.